Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at HAIRLICIOUSLY.com to purchase a microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So today in this video, I wanted to cover the topic of microneedling for promoting hair growth and show you guys the full regimen from start to finish, since it's been a while since I've done an update video using the Dr. Pen A6. Now, as you guys may know, microneedling is a great arsenal to add to your hair loss treatment regimen. There are multiple studies that confirm its efficacy in stimulating derma papilla associated stem cells and also inducing activation of growth factors by wounding. We also know that microneedling in conjunction with topical minoxidil 5% has shown significant increases in hair count. And while most of you guys will find that people who are on hair loss treatments using a combination of various things like finasteride, dutasteride, essential oils, anti-androgens, minoxidil, it can sometimes be very difficult to kind of gauge exactly the true influence microneedling has for promoting hair growth. But based on multiple studies and from the experiences of people that I've seen using microneedling, there is a fair amount of people that feel some form of needling has been a real difference maker, no matter what other topicals or drugs that they've been using. And the thing is that microneedling is another form of treatment that works in a different mechanism of action compared to like finasteride or anti-androgens. So it's really worth stacking to target and fight hair loss from different angles. So the first thing that you guys want to do right before microneedling is to wash your scalp with shampoo. A lot of times people actually microneedle without washing their scalp on a clean canvas. Not washing it prior to microneedling can sometimes cause a lot of sebum production, a lot of the oils that's been embedded, a lot of dirt. So it might not make it as effective as it is if you were to wash your head. So if you get the Dr. Pen A6, it's going to come in this nice little container. And it does come with 10 12-pin needle cartridges. There's 8 here. And if you look inside, there's actually going to be 2 more for a total of 10. These are sealed using sterile EO gas, so it keeps them sterilized. We also have the Dr. Pen, the A6 itself. Take a look here. The blue dial, you can actually change the needle depth from 0 to 2.5 millimeters, and it just works by just turning the dial to the specified needle length, which is indicated right there. And when we're dealing with hair loss, most of the studies recommend that you stick with 1.5. And some people decide to use, topical anesthetics, numbing cream, lidocaine. Other people are okay just microneedling. For myself, I'm okay just microneedling without the use of any anesthetics, but there are people who have a lower level of pain threshold, so you can apply something like lidocaine. You can get it on Amazon for like 15-20 bucks. Apply it, wait 15 minutes, and then you can microneedle. Some people who are just starting out microneedling also don't like starting off with 1.5. So you can start at a lower needle length at like 0.75, 1.0 millimeters, and then over the next few months, you can work your way up. But basically, once you take this Dr. Pen out of its sleeve, it's going to come with the adapter right there. So we have this wiring where you can actually connect it, and the tip here is actually USB. So if you're in the US, you can still use this adapter here. If you're from like a European country, or from somewhere from Asia, you can simply disregard this part here, the adapter, and then use the USB with whatever adapter that works in your country. For this sake, we're not going to use the wire because this is also wireless, so you want to take this out. And it is going to come with 2 batteries. So these are 2 batteries that are rechargeable. And you have the charger right here, which has a little hole in the back. And what you want to do is you want to screw the battery in, and then you can connect it to the wire and then hook it up to an adapter. And then once the light turns green, which is going to be indicated with this light right there, that means it's done fully charging. So these batteries actually come partially charged, so you can actually use them right off the bat. So I'm just going to go ahead and screw in one of the batteries. And a lot of the complaints that I've been getting is that some people complain that their device doesn't work, when in reality you actually have to press this button here. So you kind of have to press it for a few seconds, and if you just press it like that, it's not going to turn on. So you want to make sure you hold it, and once you see that light blinking, you'll see that it's vibrating. That just means that it's on. And there's actually 5 different settings, which increases the RPM. I typically recommend that you actually use the highest setting, because that seems to be the less painful. So that's actually the highest. You can hear right there, because the next one, it actually goes to the lowest setting. So what I like doing is, you guys can take one out from the container, screw it in, just like so. And then you want to set your needle length to 1.5. If you want to start at a lower needle length, that's up to you. But I've been doing this for a while, so for me, it's actually set at 1.5 right there. Turn it on. And that's what I'm going to be dealing with. Some people like using essential oils to help glide when they're microneedling. Other people just do it. I just do it without it, but you can look into different types of essential oils. You know, things like lavender oil, argan oil, things like that to kind of help with the gliding the session. So the area of focus for me, I don't know if you guys can see, but let me go ahead and move this out of the way. For a while, I've actually been using it on the sides of my head. There's a lot of thinning going on, also known as retrograde alopecia, and I did talk about this in some of my prior videos. But for some reason, there's a lot of thinning going on here, so I like to work on this area here. Also, same thing on the other areas. As far as the hairline itself, I did get 2 hair transplants. So if you guys take a look here, about almost ½ an inch of all these hairs in front of the hairline are implanted. So I don't technically focus on those areas as much as I do on the temples behind it, which would be kind of like the native areas, which are still going to be prone to miniaturization. So when I talk about the temples, my original temples, native temples, are actually back here somewhere. So this area right there, along with the other temple and also the mid scalp area of where the hairline is my primary area of focus. I still do parts in the hairline as well, just because, you know, you're microneedling once a week, and I still like to kind of target all of the areas on the hairline. So with that said, let's go back to our device, turn it on, go to the highest setting, and it's at 1.5, as you guys can see. And you just do it in a gliding session. Some people actually don't like gliding it. They actually like dabbing it. In my case, I just like doing it in a circular motion. Some people complain that it might, you know, damage the hair follicles. I haven't noticed that, so I like sticking with just gliding. But you can actually just go ahead and do it in circular motions as well. So let me just give you guys a quick example. I'm gonna go ahead and cover this whole area right there. As you guys can see, there's some thinning going on. So that's kind of like the tempo that you guys want to go at. Obviously, there is pricking. And the goal of microneedling is to achieve erythema, which is redness. And you guys can tell that my eyes are getting watery because I can feel some of the pricking that's going on. You don't want to push it too hard as far as pressure is concerned. Like I said, the goal is to achieve erythema, redness, and for some people, they also are able to see pinpoint bleeding. You don't want to have oozing blood from the areas that you are applying the treatment on, but if you see some pinpoint bleeding, that's totally fine too. And over the course of the next, few months, if you're not seeing any good results, or if you don't think that microneedling is efficacious, another thing that you can also do is to increase the pressure and do that for a few months and see if that works. We all have different lengths when it comes to the scalp, and some people might have thicker scalps than others. So sometimes it might actually require a little bit more pressure. It just depends on each person. But you don't want to do anything too crazy, just moderate pressure is enough. And maybe about 4 to 5 seconds per area is ideal. So something like that. And you guys can already tell that it is getting red compared to this side here. And the shorter that your hair is, I find that it's easier because it doesn't really pull on the hairs as much. If you do have longer hairs, you can still microneedle. It's just going to take some little bit more time because you have to part the scalp and expose it so they can get better access to it. That's basically what I do for the sides. Just going to go over a few more areas. And the Dr. Pen actually comes with different needle cartridges. I like sticking with the 12 pin, especially if you are applying it on areas with hair. The higher needles a needle cartridge has, the higher the chances of it actually pulling some of the existing hair. So Dr. Pen also sells the 36 needle cartridge. If you want to use the 36, you can go ahead and try it. It works better on completely bald areas because there's no hair and you don't have to worry about anything pulling the existing hairs. But I wouldn't recommend it for someone like me or somebody with thinning hair because there's a good chance that it can latch, the needles can latch to the hairs and pull it. So stick with the 12 pin needle cartridge. And yeah, that side looks good. It's going to move over to the right side. I know some people like to just dab it like that. Other people like to use the circular motion that I've been using. Other people go up and down vertically and then horizontally. Either method works. I just find going in circles actually covers more areas. And it's been working out for me. And I've also realized the scalp tends to be more thicker towards the vertex. So you might actually feel more pain, especially if you're applying microneedling in the hairline area and also even in the mid-scalp. But as you get towards the vertex, kind of like the crown area, it actually hurts a little bit less. And you'll realize that as you guys start microneedling. And the thing is, you actually kind of build up tolerance too. After a while, it might hurt in the beginning. But after 5, 6, 7, 8 sessions, it actually hurts less and less, and after a while you just kind of get accustomed to the pain. Yeah, so there's nothing much to it. Just basically targeting the areas where you're noticing thinning, miniaturization, and the goal is to activate growth factors and stimulate the hair follicle stem cell bulge. So you can see some of that redness on this side here as well. Same thing on this side here. And then let's get to the hairline. So for the hairline, I like to make sure that the scalp is exposed. You can part it out. My hair's pretty thin right now, so there's really no use for me in parting it. I can just go ahead and just microneedle some of the areas right there. Yeah, I can definitely feel it. And then just work your way up into the temples. So if you guys actually visit my website, HAIRLICIOUSLY.com, and look into my About Me page, I share with you a few photos of how I looked like before my hair transplant when I was receding. So I had a naturally high forehead, and in addition to that, I had some thinning and miniaturization going on in the temples. So if you're thinning and you also have a wide forehead, it actually makes your hair loss appear a lot worse than it actually is. It was a big complex of mine, just not being able to style the hairs that I wanted to, and just having a big forehead. Signs of balding and miniaturization in my early 20s was something that I really was not looking forward to, especially when all of your friends have a full head of hair. And so I started looking into different treatments, microneedling, taking finasteride, minoxidil, laser therapy, anti-androgens. And over the past few years, after being on treatment, finasteride, minoxidil, microneedling, different types of vitamins, and thankfully with a couple hair transplants to just really add in the density that I needed, this is where I'm at right now. So I'm very content. And just because you've had a hair transplant doesn't mean that you need to stop and not have to worry about being proactive and just foregoing these treatments. You really need to kind of continue to fight the good fight, because there's a good chance that you might still be prone to miniaturization in the native areas, so behind the hair transplant areas. And so you always want to be consistent with treatment. That's the number one thing that I always tell my viewers, to really stick with your treatment and make sure that you're just being on top of, taking finasteride, applying topical minoxidil or taking oral minoxidil, and also looking into future treatments. Don't wait for anything that's kind of like in the pipelines, because a lot of the times, or most cases, they actually don't get marketed, or they don't go through, or they don't pass phase 3 clinical trials. So stick with the current treatments. And let me just go ahead and see how everything's looking. And let me just go back in. Now the other thing you might also notice is some dandruff. And one of the best ways to get rid of that is to use a silicone scrubber. You guys can visit my website and take a look at that. But what it does is, when you're washing your scalp with shampoo, it's kind of difficult for your fingernails to get through all of the areas on the scalp. So when you're using the silicone device that actually kind of gets in and helps remove all the sebum, all the scalp, all the flakes, it does a good job in cleaning up the scalp. So I highly recommend that you guys check that out. Let's see here. But yeah, this is a very non-invasive, it's an easy procedure that you guys can all do at home. You can use a derm roller if you don't like using something that's motorized. I prefer that you guys use something that's motorized, because the wounding is going to be more consistent since the device and the motor is doing all the work, versus a derm roller, which requires your hand to basically be the machine. And if you're using your hands, it can cause inconsistencies with pressure and depth. So I like using something like this device here. Some people use the Derminator 2, which is something similar. It's also a motorized device. I also like using the Stamp, believe it or not, because it's kind of like a manual microneedling device that's not motorized. I don't know if you guys seen it, but it looks like a little rectangular derm roller, and it has a bunch of needles, and you basically just press it, and you can get up to 192, maybe even more wounding each application that you stamp on your scalp. So that's also a cheaper alternative to one of these devices. But in the long run, these motorized devices are actually a lot cheaper, because all you're doing is you're just replacing the needle cartridges. And you can technically reuse the needle cartridge about 2 to 3 times, as long as you sterilize it with isopropyl alcohol. I don't like reusing mine just because they're relatively cheap, and sometimes, depending on how much that you use on your scalp, it can kind of dull out and blunt the needles. So I always recommend that you guys replace it, but there are people that still continue to use it about 2 to 3 more times. As long as you guys are able to sterilize it fully, then that really shouldn't be an issue. So I'm almost done. Typically I go a little longer, but just for this video's sake, I just wanted to show you the areas and how you guys can incorporate microneedling into your hair loss treatment regimen. It's done once a week, like I said. It's pretty easy to use. Anyone can get access to it. You can do it at home. And once you guys are done, I highly recommend that you wash your scalp, because for some people, they might bleed or they might still have a lot of dandruff. So always make sure to wash it right after microneedling. And then 12 to 24 hours after microneedling, you can apply minoxidil. Don't apply minoxidil right after because you're creating all these open wounds. And sometimes what can happen is if you're introducing minoxidil into all of these wounds right after microneedling, there are some people who experience side effects because it can go systemic into the bloodstream, and they can get things like heart palpitations, dizziness, things like that. So make sure to wait 12 to 24 hours, which means that on the day that you guys microneedle, there's going to be a time where you're not going to be able to apply minoxidil twice a day just because of the time period where you have to wait 12 to 24 hours after microneedling to apply minoxidil. So that's basically it. As you guys can see, there's a lot of dandruff. The forehead is definitely red. There was definitely a lot more pain here. I don't have to worry about my crown area because I don't have any signs of thinning there, and hopefully I don't. But there's a lot of redness, which will subside after a few hours. Yeah, that's pretty much it. I also recommend that you guys microneedle on a weekend, just because if you do it on a weekday during a time when you have to go back to work, the redness can still be a little bit noticeable depending on how fair your skin is. So I like doing it on the weekend, and I just kind of don't worry about the redness because it will subside the next day. But that wraps up this video, guys. If you guys have any questions, let me know in the comment section below. And I'll keep you guys posted. Take care.